Hi, beautiful people. It's Wonderful Wednesday. I'm April Roll, your ER doctor online, and October is Breast Cancer Awareness Month. So, in this video for October 2022, I'm going to be answering some questions that you may have about breast cancer. Before I start, though, I do want to say that breast cancer affects both men and women. So, if that's something that just surprised you, stay tuned for the questions that I'm going to be answering in this video. The questions that I'm going to be answering are: what is breast cancer? How is it detected early? What are some symptoms that need medical attention? And how is breast cancer diagnosed? So, the first question: what exactly is breast cancer? It is cancer that forms or starts in the breast, starting from just one cell, one cancer cell, and then it invades the local breast tissue. Depending on what stage you are diagnosed or it is detected, it could have invaded other areas of the body through spreading to the lymph nodes or through the bloodstream to other organs. And that is why I want to discuss early detection in this video as well. So that's what breast cancer is: cancer of the breast that both men and women can get. The second question: what symptoms need medical attention? That includes discharge, meaning if you're having blood from the nipple, blood coming out of the nipple, or if you're having clear liquid coming out of the nipple, that's something where you need to see a doctor. Other things are if you are noticing any changes in the skin of the breast, like the texture. If you're seeing like an orange peel type of thick texture where there's some deep pores and kind of like a firm texture, if you're seeing dimpling in the skin, if you're seeing any redness or swelling in the skin, or it's looking like you're forming an infection with any pus or anything like that, that you need to see a doctor. If you're feeling a lump in your breast, you need to see a doctor to have that evaluated. And also, if you're having persistent pain that's not going away, that's another symptom where you need to see a doctor. Now, for early detection, how is breast cancer detected early? The reason that this is so important is because if breast cancer is detected in the local stage where it's just in the breast tissue, exactly where it began, and it hasn't spread anywhere else, that local stage early detection has a 5-year survival rate of 99%. That's one of the reasons it's so important to have breast cancer awareness, because many people don't even know how do you detect it early. So how do you detect it early? One thing that is important for early detection is self-exams. Another thing that's important is clinical exams. So self-exams are the exams you do yourself, and clinical exam, that's where you go to a medical professional and they do a medical professional physical exam of the breast. And if they detect anything, they order diagnostic testing. Or if you have a high family history and you're at that age under 10 years of where your family member was detected, you're 10 years younger than that, then they're going to start ordering diagnostic testing. So for the early detection, self-exams, that is where you yourself physically examine your breast. And it's important to go in a pattern where you're able to get all of the tissue from the underarm all the way inside and all the way down. So whether you're using a linear method vertically up and down, or whether you're using a horizontal method side to side like that, or whether you're going all the way outer to all the way inner, you need to be feeling all of this tissue here under the arm and completely under the breast. And when you're doing it, you want to apply some light pressure, and you're actually feeling around. Do you feel anything firm? Do you feel anything tender? Do you feel anything that's a lump? And do you feel anything different? And the importance of doing these self-exams regularly, like once a month. If you are someone who is currently having your menstrual period and you haven't reached menopause yet, you should do it at the same point of your cycle every month. So something easy to remember is either after your period ends or before your period starts. So whatever is your method, try to do it at the same point in your cycle every month, because your breasts do feel different at different times of the month. And the point of that is, if you're doing this regularly every month, you can notice when something's different and you can quickly say, hey, I need to go to the doctor because this is not right, or I feel something different and you need a clinical breast exam. That is when a doctor will do a full breast exam. And like I said, if something is detected, they may order an ultrasound or they may order a mammogram or both. So that moves me into, how is breast cancer diagnosed? There are imaging tests such as mammogram, which is a specialized x-ray for the breast specifically to diagnose breast cancer, and also ultrasound, which if you're pregnant, or if you've ever been pregnant, you know what an ultrasound is. They put the gel and they put the probe on the area and look at the baby. But for the breast, obviously they're looking at the breast tissue. And you can use these two in combination. It's very helpful. If a lump is detected through either one of these methods or both of these methods, then a piece of the tissue from the lump is tested, and then they'll know, are there cancer cells or no cancer cells present. So that is how breast cancer is diagnosed. Mammograms, ultrasounds, and biopsy to confirm or deny whether a lump or something like that in the breast has cancer cells or does not have cancer cells. These are things that are very important, and like I said, can be detected early if you are doing self-exams on a regular basis and you quickly identify something has changed where you need to seek medical attention. So the self-exam is both looking at the breast to see if there are any skin changes, see if there is any discharge from the nipple, and to see if you feel physically anything that is a lump or persistent pain. Those would bring you to having the clinical exam and getting some type of diagnostic test where they can see if it is something that needs to be biopsied, and if it is confirmed cancer, then you can go further with the next steps with your doctor. I am going to put some links below for resources for further information, further support, and things like that. If you have learned anything in this video or you like this video, please hit that like button. Please subscribe to my YouTube channel, because I promote awareness, health, and wellness, whether that be things like breast cancer and all kind of other like high blood pressure, diabetes, anything health and wellness related. I do promote and educate on this channel. So if you are interested in hearing anything about those, please subscribe to my channel so you don't miss out on anything. If you want more information, please look in the description box and check out the link for that. If you have any comments or questions, you can put that in the comment section below. If you want to recommend any future Wonderful Wednesdays videos, because I do videos every Wednesday, and if you want to request a topic of concern about health, general information that you would like to know, put that in the comment section below. But again, thank you for sharing this Wonderful Wednesday with me, learning about breast cancer. Please promote breast cancer awareness. Share this video with a friend. But yes, thank you for sharing this Wonderful Wednesday with me. Be blessed and stay healthy.